cardiovascular pathology, aortic aneurysms. All right, so for this next step, we're going to be talking about aortic aneurysms, and all aneurysms are just the dilation of the aorta. So at some point on the aorta, you're not going to have the normal vessel wall. It's going to somewhat be like bubbled out, okay? So it's going to be like a little looser. That's all that it is, okay? I never really understood that until like when I was kind of going over all the pathologies again. So just an aneurysm anywhere, okay? They'll tell you where it's at. So this one's, we're talking about the aortic aneurysm. So it's at the aorta, and it's just kind of like the bubbling of the aorta, okay? So it's that loss of the normal wall structure and it becomes dilated, okay? That's all it is. Now there's two locations in which it can occur. I'm going to go over the locations. I'm going to go over what you're going to be seeing on histology. And lastly, I'm going to be going over very common causes of it, okay, and risk factors. All of which are very, very important and you must know. Okay, so the first thing is the thoracic aortic aneurysm. So this tells you exactly where we're at. We're at the thoracic aorta, right? So the aorta that's located up towards the chest, right? And we have an aneurysm located there. This thoracic aortic aneurysm is associated with cystic medial degeneration. That's what you have to know. So thoracic aortic aneurysm is cystic medial degeneration, okay? And what we'll see for the risk factors are going to be mainly hypertension, okay? And the reason behind that is because we are at the location of the thoracic aortic aneurysm near the heart where it's pumping hard. So the majority of that pressure, okay, that we're going to feel for hypertension is going to be put on the thoracic aorta. All right, so that's why hypertension is the number one risk factor for causing a thoracic aortic aneurysm, because if we have constant high pressures in the aorta, specifically thoracic aorta, then it's going to maybe cause a bulge or dilation of the aorta, okay, and a loss of that normal vessel wall, okay? Very important to know. Now, also, connective tissue diseases are important for you to know that can cause thoracic aortic aneurysms, just like Marfan syndrome. Marfan syndrome is very highly associated with any type of cystic medial degeneration. So if you have connective tissue diseases and you see a thoracic aortic aneurysm, they talk about cystic medial degeneration, and they give you a patient that has, a chest cavity, an inward-facing chest, right? There's a name for it. I'm forgetting it right now. But, if you see that, or a patient that's really, really tall, they're trying to hint to you about Marfan's and start thinking about thoracic aortic aneurysm because they have cystic medial degeneration and connective tissue problems, okay? Now, that is, once again, all you need to know about thoracic aortic aneurysm. So just be aware that we're going to be kind of comparing and contrasting with the other aortic aneurysm. And this is known as the AAA, the abdominal aortic aneurysm. Okay. Now the abdominal aortic aneurysm now, right, we're located within the abdomen, and it's associated with transmural inflammation. Okay. And that's a question that they love to ask. So this is the difference. Thoracic aortic aneurysm has cystic medial degeneration. Okay. Whereas abdominal aortic aneurysms have transmural inflammation and extracellular matrix degradation. You have to memorize that. I'm sorry. At the end of the day, the questions that I received, I was able to pick them out immediately because of specifically those two things, okay? You're going to have to know more, but those are very, very, very helpful, okay? Now, with abdominal aortic aneurysm, the risk factor that we're going to be seeing most is going to be tobacco usage, as well as increased age and male sex, okay? So if you see a smoking male with an increased age, okay, then you know that you're at all your risk factors for abdominal aortic aneurysm. They love to ask about those risk factors. So tobacco use, increased age, and male sex, okay? Remember, thoracic aortic aneurysm was hypertension mainly, okay? So lastly, there's a triad that's associated with abdominal aortic aneurysm. So how can we tell just by a patient coming in that they have an abdominal aortic aneurysm? There's a triad, three things. There's a pulsatile abdominal mass that's present. There's an acute abdominal or back pain. And lastly, they have resistant hypotension, okay? And usually this will occur, the abdominal aortic aneurysm will occur below the renal arteries. They'll say infrarenal. But I'm telling you, the triad is probably the most important thing. Pulsatile abdominal mass, acute abdominal back pain, and then resistant hypotension, okay? So once again, overview of what we really need to understand. Thoracic aortic aneurysm, you have cystic medial degeneration, hypertension as the number one risk factor, as well as Marfan's disease. Marfan's disease has that myxomatous changes, okay, with pooling of mucopolysaccharide in the medial layer, okay, cystic medial degeneration. That's all they're trying to tell you. They're just trying to point out that it's Marfan's disease. So if all that random words that I just said, myxomatous changes with pooling of mucopolysaccharides in the medial layer, they're just pointing out to you that the patient has Marfan's, okay? So all those weird words, myxomatous changes, mucopolysaccharides, they're pointing to Marfan's, okay? And that has increased risk of thoracic aortic aneurysms, right? And then abdominal aortic aneurysm has that transmural, all three layers, inflammation and extracellular matrix degradation. And the risk factors are tobacco usage, increased age, and male sex. The triad is going to be pulsatile abdominal mass, acute abdominal back pain, and resistant hypotension. Okay, that's all you need to know for these aneurysms.